Are you exploring your health problem from a surface level, or are you digging deep? This video is all about how digging deep and finding the root cause of your health problems will mean that you'll achieve an uncommon recovery. This is part of a 14-part video series that explores how trauma, stress, and anxiety play a pivotal role in health recovery. Hi there, I'm Dr. Chanu Dasari. I'm a surgeon who specializes in reversing gut microbiome dysfunction and autoimmune inflammation. My technique for reversing symptoms in as little as 6 weeks has helped thousands of patients over the years and is called the Mind-Gut Immunity Method. And if you'd like to learn more, visit mgiclinic.com and request a discovery call. Now, many of you know my personal story. In my early 20s, I struggled with autoimmune disease and digestive dysfunction. And I was able to fix inflammation naturally using the same methods that I now use in my patients. But even after all these years, after my recovery from autoimmune disease and digestive dysfunction, I've still struggled with the anxiety and frustration. Why was I so sick? Why did I ignore the early signs? Why did I let stress take over? And more importantly, why did I deprioritize myself in these situations? These lingering questions were important ones for me to answer because they were at the heart of why I became sick in the first place. After working with thousands of patients over the years, I can tell you that the themes of trauma, stress, and anxiety keep popping up. So in the Mind-Gut Immunity Clinic, we've enlisted the help of a personal development coach to help create awareness for my clients to understand how anxiety, stress, and trauma play a pivotal role in autoimmune inflammation and digestive dysfunction. It's a mini personal development workshop, if you will, within the Mind-Gut Immunity Clinic that creates awareness around illness. Our clients work one-on-one with our coach, Virginia, who you'll see here today, to integrate new awareness and thought processes into recovery. I can tell you from personally working with Virginia over the years that this is a much needed addition to the Mind-Gut Immunity Academy. And from the positive feedback I've received from my patients, I know that this is something that can help others in their healing journeys. We'll be touching on some of the topics such as how most medical settings just look at a problem on the surface level and why that can be exceptionally limiting. So, we get this a lot, right? Like somebody has identified a problem in their lives, but they don't really spend the time to take a deep dive and really analyze why the problem exists, how to really solve the problem. We're talking about the people that the minute something happens, they pick up their phone, they talk to their friend for 15 minutes, but they don't go deep enough to address any of the underlying issues, the perspective that needs to change. How do you prevent that like in your sessions with clients and in folks that have digestive dysfunction, autoimmune disease? How do you go beyond the surface level? How do you dig deep to try to analyze their critical thinking and provide an empathetic perspective?
One, trust, right? You have to create trust and non-judgments. But one of the ways to go deeper is listening to the original statement and asking myself, what's beyond that? For example, I had a client, well, I don't want to do this because it's boring. Well, boredom is a form of escapism. So going deep, tell me about that boredom, because this may be an idea that they've had for a while. They think they need a lot of variety, but what are they trying to escape from that they constantly need variety? So these are the types of conversations I like to have with people in going deeper. Let's take that another layer deeper, because there's always a root cause. It's just that we like to stay on the surface because it can get a little scary and vulnerable to go deeper.
Yeah, and I get this a lot, right? Like one of the key things that I have is, we have a lot of people with autoimmune disease, and these folks, if you ask them, they'll say, well, I'm taking care of my whole family. I'm going to work, right? And then they think they're so perseverating over the content of the problem, which is the content of the problem is there's a lot of work to be done, right?
Mm-hmm.
But if you dig a little bit deeper, right, these folks essentially are spreading themselves thin. They're taking on obligations that they probably don't have the fuel to undertake. They're doing it
And
because
not have boundaries, for sure.
correct. They haven't established boundaries. They're doing it because they don't want to let somebody down. they're doing it in somewhat in a weird way, like just to have value or importance, and don't, they don't want to, they want to please the person that they're trying to, help. Or in other case, they're trying to earn income for their family, and that matters too. But
Yeah.
it's all a bunch of these like external motivators. There's not a whole lot of like, this is intrinsically satisfaction, this is intrinsically satisfying, right? So if you were to unwind that, right, like if you were to delve deep into that, they say my problem is I have too much work, I have too much on my plate, right? And their 15-minute version of their phone call, they're complaining to their friends like, oh, I have, all this work that I have to do, but they're not really figuring out, they're not analyzing like, how did that work end up on the table? Like how did it end up that you were in charge of getting all that done?
So there's smoke screens, right? They're smoke screening themselves and others because there is an intrinsic need that they're trying to fill, but no one's ever stopped long enough to ask them what that is. So they're getting something out of it. They just don't know what that is at that time. So we go deeper with them to actually get down to what are their core values so that they can get those needs met, not the apparent surface level need met
Yeah.
to be people pleasing, but what's behind people pleasing? I want to be loved. Abandonment. I don't want someone to not like me.
Yeah. But
So we,
instead they want to talk about the boss that's overly critical or
that's
puts too
right.
much work on their plate. Or they want to the blame tends to they tend to assign blame, first of all, but second of all, it tends to be externally placed a lot of times. Or if it's internally placed, it's not placed in the right, it's not, the internal dialogue associated with it is very negative. It's to say that, I'm supposed to be doing this sort of thing, or this is what I was meant to do, or because otherwise I'm going to let this person down, and then I'll be a, a not so good spouse or employee, or whatever the case may be. Fill in the blank
It's
there.
usually a pattern there, right? I would ask them, so what was your previous boss like? So there's most likely going to be a pattern in every job they've gone to where they bring themselves that we can uncover and then shift the habit because these things are just habits. We just don't realize that we're contributing to the habit by our behavior. So then we look outside of ourselves. So we're here to empower them to understand their own pattern so they can shift their behavior so their outside environment can change.
Yeah, that's a very good point. So when you're trying to dig deep and trying to get to that really critical level of thinking, when's the aha moment? When do you know that you have gotten to that, beyond just the superficial kind of, all the smoke screen, so to speak? How do you know that you've gotten to the root of the problem?
That's the funnest part of my job because it literally lights them up because they will literally be like, oh, I've never thought of that. You can literally see the shift. And then there's usually no one going back from that shift. It's like a dam that got unplugged. So it's pretty obvious when someone has a shift. And with curiosity and fun, we can keep evolving until we get the shift. So I think it's obvious to answer your question. They light up. People light up because the light bulb just goes off.
How do you see people avoiding the topic, right? Because there's surface level discussions. That's one way of avoiding it. There's smoke screens where they want to talk about some other thing, right? They'll like want to talk about this one thing which they think is the problem, but really
Mhm.
it's some other thing, right? But what are some other patterns of avoidance do you see? Like what are some? I mean, you work with clients day in day out. Like what do you see?
There's the blame game. It's not their fault. I had no choice. They imprison themselves with this I can't do anything about it feeling, or they just don't want to take on the responsibility of having to put their foot down with other people. There's just escapism left and right, whether they start drinking or they're just they're replacing things with like alcohol and drugs or whatever in order to find their happiness
I'll
instead
put
of facing the issue.
I'll add something in there. Okay. I'll add something in there. I think one of the avoidance patterns that I see as a clinician is people not taking care of their unmet needs.
Yes.
Because, obviously that's a problem. Obviously it's a trauma response. Obviously it's somebody that has not, they're going to physicians, and the physicians are talking about, oh, well, you need this medication to suppress the immune system to fix the inflammation, or here, try this out and that'll fix your digestive dysfunction. But they don't really go into why or how or what are the things that are going on, right? Because this happens in like in a medical context as well, right? And
Yeah.
that's really how we're exploring a lot of these topics. But and I see it all the time. People do not like, I would say the reason we have rampant autoimmune disease, rampant digestive dysfunction is people do not want to do the hard work of knowing why, identifying why, getting down to the deep root cause level as to why they're feeling the way they feel, why they have the symptoms that they're having, why their inflammation is there. It's like an avoidance of the problem itself, right? And then all they want to do is engage with clinicians or people and have these surface level 15-minute discussions about how they can quote unquote fix the problem or put a band-aid over the problem, or just I guess complain, right? But to do the hard work, right? To do the hard work, they have to actually sit down and go through what all of the, what they're putting into their body, how they're living their lives, what are their assumptions, what are the limiting beliefs. There's like a lot of work that needs to be done, and not everyone is ready to do that work.
And one of the biggest things is understanding and accepting that you're responsible to meet your own needs, and that you're meant to figure out, how do I feel secure? How do I feel safe within me so I can come whole to whomever I'm with, versus so and so is responsible for meeting that need. I think, once you're past adulthood, you definitely get to accept that you're responsible for meeting your own needs.
I think that's totally, that I see that. And I see that, I mean, not
I
just
see that a lot.
from a healthcare perspective,
Yes.
but I see that in a lot of like just personal development, from a personal development standpoint. I agree. I think you need to know when you're not safe. I think you need to know why. Why do you feel that way? I think you need to know, and you have to have confidence and the courage to identify what those things are, because otherwise you're not getting to the root cause. You're just creating frustration in your life and really just wasting time, because these problems just fester and fester, and then you get really bad disease, or you get really bad problems in your own personal life because of it.
And teaching yourself self-regulation, it's not our fault. We're really not even taught this stuff. And I don't want to get on a tangent about schools and what they teach us or don't teach us, but what about emotional regulation? What happens when I get angry? What do I do? What happens when I cry? What do I do? Unfortunately, if your parent didn't have self-regulation, they can't teach you self-regulation. And unless you take an effort on your own to teach yourself that, you're functioning on autopilot, and that could be erratic.
Well,
So,
let me pile on to that, because I
yeah.
think not only emotional self-regulation,
Mhm.
but a lot of the inner child work and all inner development work, they talk about even just labeling the emotion.
Yeah.
Like, it's one thing to have emotional regulation. It's another thing to even know what emotion you're feeling. Like, people will feel an emotion and not even register what the emotion is. So I'm going to pile on to what you just said and say, it goes even beyond that. It's people are not even aware of the way they're feeling.
And once they identify the emotion, how do I soothe that emotion? Whether it's sitting with the grief or the anger for a minute, but not acting on it from some sort of impulsive or immature or hurt, wounded place, so that you can progress to healthy dialogue.
Yeah, I would agree. Going in depth on topics such as these allow us to achieve uncommon healing. We already do a good job at solving gut microbiome dysfunction at the root of inflammation, and we make strides in trying to unwind the perspectives and behaviors that create illness in the first place. And that's how we achieve a lasting recovery. Now remember, we've got 13 other videos on similar topics, so if you found this conversation useful, be sure to check out the other videos. Also, share these videos with someone you know who's struggling with a health condition and doesn't know where to start. Sometimes just starting the discussion with them can help them change their perspective on illness. Lastly, don't forget to like and subscribe. And as always, I'm Dr. Chanu Dasari with the Mind Gut Immunity Clinic, and I'll see you next time.